Have you ever been jolted awake in the middle of the night by a sudden, painful cramp in your leg? Or maybe you're simply walking, exercising, or even sitting, and out of nowhere, your calf tightens up like a vice. It's uncomfortable, frustrating, and sometimes even scary. If that sounds familiar, you're not alone. Millions of people, especially those over 40, deal with leg cramps regularly. But here's the good news. In most cases, they're not just random. Your body could be trying to tell you something very specific. Leg cramps are often your muscles' cry for help. And more often than not, the real cause isn't age, stress, or overuse. It's a lack of essential nutrients that your muscles rely on to function properly. You might be surprised to learn how a simple deficiency in just one mineral can lead to all that pain. But once you know which nutrients to focus on, the solution can be as easy as making a few changes to your diet. In this guide, we're breaking down the top 5 nutrients that help prevent leg cramps, naturally and effectively. These aren't exotic superfoods or complicated supplements. They're simple, science-backed, and easy to add to your routine. Whether you're an active adult, a senior trying to stay mobile, or just tired of those annoying nighttime cramps, this is information your body will thank you for. Stick around, because by the end of this, you'll know exactly what your muscles need, and how to stop cramps before they ever start. 1. Magnesium. Magnesium is one of the most important minerals for muscle function. It plays a key role in helping your muscles contract and relax properly. Without enough magnesium, your muscles can become overly sensitive and more prone to spasms and cramps. This is especially true for people over 50, since magnesium levels often drop with age. Poor diet, stress, certain medications, and even alcohol can deplete magnesium levels. One of the ways magnesium helps is by regulating calcium movement in and out of your muscle cells. When calcium builds up too much inside a muscle, it can stay contracted, which causes that tight, painful cramp. Magnesium helps prevent this by balancing calcium levels and calming the muscle. Symptoms of magnesium deficiency often include twitching, tightness, irritability, and of course, leg cramps. The good news is that magnesium is found in many everyday foods. Leafy greens like spinach and kale are excellent sources. Nuts, seeds, whole grains, and legumes are also rich in magnesium. Even dark chocolate and avocados offer a healthy boost. For some people, especially older adults, food alone may not be enough. In that case, magnesium supplements, like magnesium glycinate or citrate, can be helpful. They are easier on the stomach than other forms and tend to be better absorbed. Getting enough magnesium can make a noticeable difference in how your muscles feel day to day. It may not just stop cramps but also help improve sleep, reduce headaches, and ease anxiety. If you're having frequent leg cramps, especially at night, magnesium is a great place to start. It's simple, affordable, and safe for most people. But as always, check with your doctor before starting any supplement, especially if you're on medications. Your muscles need magnesium to stay smooth and relaxed. Don't let a simple mineral deficiency cause unnecessary pain. 2. Potassium. Potassium is a key mineral that works closely with sodium to regulate muscle contractions, fluid balance, and nerve signals. When your body lacks enough potassium, your muscles can become weak, shaky, and more prone to sudden cramps, especially in your legs and feet. This is because potassium helps control the electrical impulses that make your muscles move. Without it, the signals can become mixed up, leading to painful spasms. One of the reasons potassium deficiency happens so often is because the body loses it easily. Sweating during exercise, taking diuretics, dehydration, or even not eating enough potassium-rich foods can quickly lead to low levels. This is why people who are physically active or take certain medications often deal with leg cramps more frequently. The best way to restore potassium is through a healthy diet. Bananas are the most well-known source, but they're far from the only one. Sweet potatoes, oranges, avocados, spinach, beans, and even coconut water are excellent sources of potassium. These foods not only provide potassium but also come with other helpful nutrients that support muscle health. Getting enough potassium helps balance out sodium in your body. If you eat a diet high in processed foods, you're likely getting too much sodium and not enough potassium. This imbalance can increase your risk of cramps, high blood pressure, and other issues. By increasing your intake of potassium-rich foods, you can help restore this balance and ease the strain on your muscles. It's important to note that too much potassium from supplements can be dangerous, especially for people with kidney problems. That's why food is the best and safest way to get it. If you're concerned, ask your doctor about testing your levels before starting any supplement. Potassium plays a quiet but powerful role in keeping your muscles healthy. A steady supply from good foods can help reduce cramps, boost energy, and support your heart and nerves. Don't underestimate this mineral. Your legs, and your entire body, depend on it. 3. Calcium. Calcium is widely known for building strong bones, but it also plays a major role in how your muscles contract and relax. When your calcium levels drop, especially in your bloodstream, it can cause your muscles to contract involuntarily, leading to tightness, twitching, or painful cramps, particularly in your legs and feet. This is more common in older adults, especially women after menopause, as natural calcium levels often decline with age. Calcium helps transmit nerve signals to your muscles. These signals tell the muscle when to move and when to stop. Without enough calcium, those messages can misfire, leading to muscle spasms. That's why a lack of this one mineral can cause so much discomfort. Low calcium can also interfere with how other key minerals, like magnesium and potassium, do their jobs. All of them work together to maintain smooth muscle function. So if calcium is too low, it can throw off the whole system, even if the other minerals are present in good amounts. Dairy products like milk, yogurt, and cheese are among the richest sources of calcium. But if you're lactose intolerant or prefer plant-based options, you can also get calcium from leafy greens like kale and collard greens, fortified plant milks, tofu, almonds, and sesame seeds. Sardines and salmon with bones are excellent animal-based sources as well. For some people, especially seniors, calcium supplements might be recommended, particularly if there's a history of bone thinning or osteoporosis. But it's best to get as much as you can from food first, because food sources are easier for your body to absorb. It's also important to remember that your body needs vitamin D to absorb calcium properly. So make sure you're getting enough sunlight or taking a supplement if needed. Calcium does more than protect your bones. It helps your muscles perform every little movement without pain or stiffness. If you're experiencing frequent cramps, especially in your legs, calcium could be the missing piece of the puzzle. Keep your muscles calm and your body balanced, by giving it the calcium it needs daily. 4. Sodium. Sodium often gets a bad reputation because of its link to high blood pressure. But when it comes to preventing leg cramps, sodium plays a very important role. It helps regulate fluid balance, nerve function, and muscle contractions. Without enough sodium, your muscles can misfire, become overly tense, and lead to painful cramping, especially during or after exercise or in hot weather. Sodium is one of the main electrolytes in your body. Electrolytes are minerals that carry electrical signals to help your muscles and nerves work properly. When your sodium levels drop too low, this electrical communication breaks down. Your muscles may respond by tightening up suddenly, which can result in those sharp, uncomfortable leg cramps. This is especially true if you've been sweating a lot. Whether you're exercising, walking, working outdoors, or just dealing with hot temperatures, sweat causes your body to lose sodium. If it's not replaced, cramps may follow. Dehydration and overhydration without electrolytes can also dilute sodium levels, triggering similar issues. Now, while processed foods are high in sodium, they don't provide the kind of balanced electrolyte support your muscles need. That's why athletes often use electrolyte drinks with balanced amounts of sodium, potassium, and magnesium, especially after long periods of sweating. For most people, getting the right amount of sodium isn't about eating more salt. It's about balance. If your diet is very low in sodium and you're experiencing leg cramps, you might need to slightly increase your intake, especially if you're active, over 60, or on medications that lower sodium levels. Lightly salting your meals or drinking an electrolyte solution might help. Always speak with your doctor if you suspect low sodium, especially if you're on a low-salt diet for heart or kidney health. Too much sodium can be harmful, but too little can also disrupt how your muscles function. Sodium helps your muscles stay relaxed and your nerves stay sharp. When balanced correctly, it's a powerful ally against leg cramps. 5. Vitamin B6. Vitamin B6 is often overlooked when it comes to muscle health, but it plays a surprisingly important role in preventing leg cramps. This vitamin is essential for proper nerve function and helps your muscles communicate with your brain. When your body doesn't have enough B6, those signals can become weak or mixed up, which may lead to nerve irritation and muscle cramps, especially in your legs. Vitamin B6 supports the creation of neurotransmitters, chemical messengers that carry signals between nerves and muscles. It also helps regulate levels of other minerals, like magnesium, which are directly responsible for muscle relaxation. When your B6 levels are low, magnesium may not work as effectively, and this can increase the chance of cramping. Older adults, especially women, are more likely to develop a B6 deficiency. Certain medications like diuretics and some types of blood pressure pills can also reduce B6 levels over time. People with diabetes, kidney conditions, or alcohol use issues are at even greater risk. Symptoms of low B6 often include numbness, tingling, muscle weakness, and frequent cramps in the legs or hands. The good news is that vitamin B6 is found in many common foods. Chicken, turkey, and fish like salmon and tuna are great animal-based sources. Plant-based options include bananas, potatoes, chickpeas, and fortified cereals. These foods not only help with B6 but also support overall muscle and nerve health. If your diet is limited or you have medical issues that affect absorption, a B6 supplement might help. However, it's important not to overdo it. High doses over time can cause nerve damage. Stick to the recommended daily amount unless advised otherwise by a healthcare provider. Vitamin B6 is a quiet protector of your nerves and muscles. Getting enough of it can help reduce the frequency and severity of leg cramps. It also boosts mood, supports immune function, and keeps your energy levels stable. Don't overlook this small but mighty vitamin. Your muscles will thank you for it. Leg cramps are often a sign that your body is low on key nutrients. Magnesium, potassium, calcium, sodium, and vitamin B6 each play a critical role in how your muscles contract, relax, and respond to nerve signals. A lack of even one of these can lead to painful, sudden cramps, especially in your legs and feet. The good news is that the solution is often simple. Eating a well-balanced diet rich in these nutrients can make a big difference. Leafy greens, nuts, dairy, fruits, whole grains, and lean proteins are all excellent sources. Staying hydrated, especially in hot weather or during exercise, is just as important. Supplements can help if you're unable to get enough from food, but always speak with your doctor before starting anything new. With the right nutrition and a little care, you can keep your muscles relaxed, your nights peaceful, and your legs cramp-free.